all the eloquent and enthusiastic panelists and the chairpersons for smooth conduct of our panel discussion. I also thank Professor Sartorius and Professor Isaac for their valuable suggestions. One of the essential lessons from the COVID-19 pandemic was that the mental health professionals need to collaborate on a global platform. We invite Dr. Victor Pereira Sanchez to talk about the need for having a global collaboration. He is fellow and clinical instructor in Child and Adolescent Psychiatry Department of NYU Grossman School of Medicine, New York, USA. Dr. Victor Pereira Sanchez is the co-founder of the Spanish Society of Psychiatric Trainees, founder of the World Network of Psychiatric Trainees, coordinator of the Global Mental Health Think Tank. It's with immense pleasure that I invite him to speak on need for having a global collaboration. Over to you, Victor.
Okay, thank you very much. I'm gonna connect my headphones to make sure that the audio is okay. Well, and thanks to all who have stayed during this afternoon, evening. Here is still morning in New York. And thanks to the organizers, to the panelists. For me, this is a dream coming true because this we have foreseen this for now 4 years. So, well, good morning from New York, Manhattan, and I have been asked to talk about my deepest professional interests that are the collaboration with colleagues worldwide in global psychiatry and mental health endeavors. And I'm so happy to talk among many old and new friends. So why setting up international organizations? So young mental health professionals, early career psychiatrists, trainees are enthusiastic to improve the life of the patients they meet every day and keep struggling to become ever better professionals. However, they often feel frustrated about the structural barriers that hinder their professional development and perpetuate the healthcare inequalities and poor mental health outcomes among patients. So early in my residency training in Spain, I realized about the need to team up with colleagues to achieve great purposes. Since then, life brought me through an escalating progression to ever widen my scope. An isolated early career psychiatrist faces everyday challenges to meet their clinical duties, study, conduct research, and take care for the rest of their rich lives. When they look around and collaborate with their colleagues at their own institutions and at other institutions in their country, they are empowered to make substantive changes in their profession to favor their colleagues, patients, and society, and develop valuable research. On the other hand, international associations expand the reach of these possibilities and open new ones. And furthermore, international collaboration is a necessity and a duty. So on the one hand, inequalities in health outcomes and healthcare access across countries, and even within high-income countries like the US, are particularly sharp in mental health. And this calls for global psychiatry and mental health that comprise a set of efforts to ensure good mental health for everybody, everywhere. On the other hand, global problems require global solutions, and the current pandemic has not spared anyone and has put humanity in the need for uniting efforts to mitigate the spread of the virus and find vaccines and treatments. So for the good and for the bad, COVID-19 came in an era of borderless telecommunications. Current early career psychiatrists and trainees belong to the millennial generation that could be seen by many as an unlikely solution to these challenges. But I argue that we can harness our global mindset to contribute to creating enriching and diverse working environments, and our technological skills to communicate with each other and provide uninterrupted services to patients and promote mental health through the social media. We just need to work together. And I will now just briefly dedicate a few slides to show you my trajectory in contributing to collaborative efforts by early career psychiatrists and trainees. So when I started my residency in Spain in 2015, my chief resident invited me to join a small group of trainees across the country that would establish the Spanish Society of Psychiatric Trainees. And I wasn't sure that a national association would be useful, but apart from networking with other colleagues. But as we start growing fast in membership, we were able to bring about initiatives that have not only formed lasting friendships, but also gave a unified voice to psychiatry residents in Spain to advocate for the best standards in our training. For instance, we addressed a letter to the Ministry of Health asking for the establishment of child and adolescent psychiatry training, and we had not been successful so far, but we'll keep talking about this. And then between 2016, 2019, I was very active in the European Federation of Psychiatric Trainees, and specifically, I was the chair of MENTA working group. So MENTA stands for Maintaining and Establishing National Trainees Associations. And this group was mainly in charge of helping colleagues from countries not yet represented in the federation to build their own associations and join us. And as we almost filled the entire European continent with associations, we felt it would be important to establish frameworks for collaboration between European and non-European trainees. So we launched the FPT MENTA Overseas Award, which in 3 editions so far was able to bring trainees from other world regions to our fora. And many of them are here in this call. In 2018, just to finish, I teamed up with a growing group of psychiatric trainees from different countries of the world, and we launched the World Network of Psychiatric Trainees. So this network is an informal framework facilitating communications and collaborations among trainees without borders. If you are a trainee and are not yet a member, please reach out to me. For this long list of objectives, we have already organized online fora and participated in mental health promotion and advocacy campaigns, and we have enabled channels for international research and facilitated learning resources to trainees from low and middle income countries. So we have more than 230 members from all over the world, we are especially strong in Brazil, Nigeria, and Indonesia. One of the most recent and rewarding initiatives were the virtual forums. So far we have 2 virtual fora organized by us, bringing different topics like structural racism in the US as affects to psychiatric trainees, and also global mental health in the Horn of Africa by our first member in the network that comes from the Horn of Africa. And there are more other avenues for collaboration. So you can reach out to Mariana, who is in this call, to join the early career psychiatry section of the WPA and join other initiatives, social media campaigns, and travel the world through Zoom to meet many people. So thank you very much.
Thank you, Dr. Victor, for those wonderful words.